Hello, welcome to this webinar on chronic kidney disease in primary care, early identification and intervention for improved outcomes. My name is Professor Samuel Seidu. I'm a Professor of Primary Care Diabetes and Cardiometabolic Medicine at the University of Leicester. In this webinar, I'll be joined by three esteemed colleagues: Baruch Ishak from Israel, Louis Moyes from Canada, and Mehmet Ungan from Turkey. Here are our disclosures. So the learning objectives of the webinar will be first, recognizing chronic kidney disease as a silent disease, and as part of the multiple long-term conditions that we see in the primary care setting. We will also endeavor to discuss and apply tools that will help in achieving early diagnosis and management in the primary care setting. And we'll try to integrate all these tools together with medication use and decisions about early referrals. The agenda is going to be as follows. After this quick introduction, I will go through the burden of chronic kidney disease in the primary care setting. And then after that, I will hand over to my colleague Baruch Ishak from Israel, who will take us through the early identification and stratification of chronic kidney disease in primary care setting. I will then come back and join the discussion on the early management of people with chronic kidney disease in the primary care setting. And then Louise will lead us in the discussions around the referral procedures from primary to secondary care when it comes to chronic kidney disease. This webinar is ACME accredited, and you can claim your continuing medical education points after completion. The activity is supported by an educational grant from AstraZeneca. You would have done your pre-assessment questionnaire, and we will be supplying the same questions after the end of the discussions for you to have a go at them and see whether your knowledge has improved after the discussions. You can send questions or any comments during the panel discussions, and we will try to answer them as the discussions go on. So quickly on the burden of chronic kidney disease, this is now noted to be a public health emergency. We now know that there's over 843 million people with the condition, and the numbers keep rising. So the burden of chronic kidney disease cannot be underestimated. The other worrying point about chronic kidney disease is that a lot of the patients, some data suggests more than 60, and in other data sources, more than 80 and 90 are reported of patients with chronic kidney disease that remain underdiagnosed. So there's clearly an issue, given that the early stages of the diagnosis is done in primary care setting. A lot of efforts have to be made in the primary care setting to foster early diagnosis and management. Delay in the diagnosis can lead to several problems. First of all, for the 10% of patients with chronic kidney disease that end up with renal replacement therapy or transplant, if the diagnosis is not done early, that progression is inevitably going to occur. The vast majority of patients with chronic kidney disease die of other conditions even before they reach renal replacement therapy, such as infections, cardiovascular diseases, for example, heart failure. And if we diagnose these patients early, interventions can be put in place to prevent these from happening. Chronic kidney disease, if it's not diagnosed early, can lead to diminished quality of life and increased the risk of premature mortality. So primary care is our first line of defense against chronic kidney disease. Primary care healthcare professionals have to have the background knowledge and time resources to be able to identify and treat patients very early. There should be greater emphasis on detecting this condition and managing it properly before referring to specialist colleagues. So for a recent survey across Europe, that just knowing or having confidence in the diagnostic criteria and the staging leads to better decisions around the choices of management, pharmacological management, be it using RAS inhibitions or SGLT inhibitors. Those that know the diagnostic criteria and the staging, compared to those that don't know, there is a 6.5 likelihood of knowing when to choose the right medications. And similarly, if you do have that knowledge, you are able to choose the newer agents such as MRAs and SGLT inhibitors compared to those that do not have that knowledge. There are a lot of barriers that we come across in primary care, and some of the barriers that we always hear are workload implications in the primary care setting, lack of symptoms in patients with chronic kidney disease. It's a symptomless disease in the very early stages, so patients do not present with suspicions of chronic kidney disease, and clinicians don't diagnose it very early as a result. So what we suggest to address these barriers will be to educate primary care colleagues about the nature of chronic kidney disease, emphasize on the risk factors such as diabetes, hypertension, cardiovascular disease, and family history of chronic kidney disease, so that patients who have these on their computer records can be screened very early on to diagnose the condition. Educating primary care healthcare professionals about the diagnostic criteria using EGFR and ACR is so important. ACR testing is very poorly done in most primary care settings, and one of the suggestions that have been made in certain countries is to work with the patient so that they can learn to do the testing themselves at home. In these situations, a kit is posted directly to the patient's address, bypassing the healthcare professional. They then do the DIY testing themselves, and if they are found to have evidence of protein leakage in the urine, these results can be fed back to the GP, who would then arrange a confirmatory testing. And if it's confirmed, a diagnosis is made, and the patient is started on appropriate treatment options. To help primary care professionals do this properly, KDIGO heat map has been adapted by ISN Primary Care Diabetes and other organizations, and made very similar to a one-pager. And this one-pager contains all the information that you need about the screening and early identification, management, and referral for patients with chronic kidney disease. This one-pager can be printed and laminated and stuck up on your consultation room boards to remind you when to do what when it comes to chronic kidney disease.